Hi, my name is Tom. I live in Los Angeles with my wife, Lisa. I'm a pianist and composer, and I'm a small business owner. And I'm also living with NET, although that's not my primary identity. I was diagnosed in 2015 with pancreatic NET that had metastasized to my liver. My NET is grade 2, well-differentiated, non-functional. I've had surgery, monthly lanreotide injections most of the last 7 years. I've had a couple radio frequency ablations to my liver, and I've had PRRT. Actually, I've had a total of 8 rounds of PRRT. I had 4 rounds back in 2016 at Excel Diagnostics in Houston. I had another 2 rounds in 2019 at UCLA, and then I just recently finished another 2 rounds at UCLA. So I guess from the patient perspective, I'm very familiar with PRRT. And that's what I want to talk about today. First, I want to say I'm a big fan of PRRT. I've gotten really good results, which have given me stretches of multiple years of stable disease. And I've been able to live a pretty normal life. It's allowed me to spend my time on the things that I find fulfilling and not have to always be thinking about NET. So if you're considering PRRT, you probably have some questions, maybe even some anxieties. I know I did back in 2016. I just didn't know very many people who had ever had PRRT, so I didn't know what to expect. But now I've done it 8 times, so I feel very comfortable with it. So let me just sort of walk you through what the treatment day is like. First of all, you arrive at the treatment center very early in the morning. They start an IV, and you sit in a big, comfortable chair for about 5 hours. Most of that time, the IV is the amino acid mixture, which protects the kidneys, along with some anti-nausea medication. The actual PRRT drug, Lutathera, only takes about 30 minutes in the middle of that session. It's actually kind of boring. So I'd recommend bringing something to read. The first time I had PRRT in Houston, I did experience some nausea, but I think that was mainly because back then the amino acid mixture that was used is different from what's used now. The last few times, I didn't really experience any nausea at all. And of course, the anti-nausea medication helps. During the part of the infusion where the Lutathera is given, apparently I'm in the minority of patients who report having a mild hormonal response. For about 10 minutes, I feel hot and sweaty and nauseous. And we found that by decreasing the rate of the infusion, we can greatly reduce that. In fact, the last couple of times, I think I hardly noticed it at all. But like I said, it's not something that very many people experience, so I wouldn't worry about that. After the IV is done, the nurse will do a quick check of your radiation level to make sure you're safe to go home. And even that's not very exciting. I like to imagine that I can come home and play with my dog and she'll develop superpowers, but it hasn't happened yet. Actually, from a meter away, my radiation level is only slightly higher than normal. I find that about 24 hours after PRRT, I develop mild flu-like symptoms, some nausea, a general achiness all over, mostly fatigue. And then for about 2 weeks, I just feel tired. It's not debilitating, but it does mean that I have to lie down in bed a couple of times throughout the day. That goes away after about 2 weeks. I've found that for me, the side effects are pretty consistent over all the times I've had PRRT. So I just block out 2 weeks on my calendar. I tell people that I'm unavailable. for me, it's worth it, because then aside from periodic scans, I don't even need to think about NET for a couple years. And that to me is the biggest benefit of PRT. I mean, having good scan results is great. I don't want to diminish that. But I'm more than my scan results. And my life now it's just like having my life back. I mean, I get to spend quality time with my wife. Today is our 16th wedding anniversary. We've gotten to travel. We get to eat great food, and I get to work on music. I've released a few albums over the last few years, and I just finished a big music video project, and I'm starting to get ready to record my next album. So life is good. I'm very grateful. If you have questions about PRT, I would just encourage you to talk to your medical team, to reach out to NET experts and NET advocacy groups. And there are a lot of people who have had PRT, like myself, who would be happy to talk to you about it. Wherever you are in your journey with NET, I just want to say there's hope. And I just wish you the best.